Hello, everyone, and welcome back to the discussion on the digestive remedies by Dr. E.B. Nash. We have already completed Pulsatilla and Bryonia by Dr. Nash, and right now we are heading to Nux Vomica. So, let's discuss the topics which Nash, first of all, Dr. Nash explains under Nux Vomica. So, Dr. Nash starts with the characteristic symptom given by herring and he explains a concept along with it. Then he goes on to the understanding of the temperament of Nux vomica. And if you have been watching all the videos, all the discussions on the digestive remedies, you've already seen that he has explained the temperament of Bryonia as well and Pulsatilla as well, and now he'll go on to explain the temperament of Nux vomica, and through that we will be able to differentiate how all three have the kinds of various different kinds of temperaments, right? Then he goes on to tell us the action on the digestive organs, which also he has explained in both of these, because obviously because these are the digestive remedies of Nash, right? So that is why he has to explain the action on digestive organs. And then action on female reproductive system, okay, these two he has explained. And then he goes on to explain us the fever, the characteristic symptom of Nux vomica in fever, and headache and backache of Nux vomica finally. Alright, so these are the topics which we will be studying, and let's start with the first one right now. Okay, so he says that one of the characteristics which Dr. Herring gives us is that the use of Nux vomica should be done after aromatics in food or as medicine. Okay, so aromatics are some type of ingredients. So when you use these aromatics when preparing food, or you use them as medicines, whatever, particularly ginger, pepper, etc. So these are some examples. And after almost any kind of so-called hot medicines, you can use Nux vomica. So that is what he says. Okay, you can use Nux vomica after any kind of hot medicines. What is hot medicines? So in Indian household, our mothers, our grandparents usually tell us that some type of ingredients that we use in food are hot, meaning that in Hindi or in Marathi they will say that ushna padartha. Okay, so hing is a ushna padartha, khajur or dates are also called as garam. They say that garam padta hai wo. So these are the kind of hot medicines. Ginger is also hot, right? So that is why it is an example. So after any type of such medicines, if you have any issues, you can give Nux vomica. That is what Herring says. And then he also writes, it will also benefit persons who have been drugged by mixtures, bitters, herbs, and so-called vegetable pills, etc. So Nux vomica will also benefit those people who have been drugged, means they have taken it in a lot of excess, okay, taken it in a lot of quantity. By what? So mixtures means like kadhas, for example, bitters, herbs, so various kinds of jadi butiya, and so-called vegetable pills. When they are taken in excess and the patient has some kind of problems, you can think of Nux vomica. Then what does E.B. Nash comment on this? He says that Nux vomica will benefit in such cases only when the use of such drugs, aromatics, pills, etc., okay, bring on or produce a condition that stimulates the symptom produced in the proving of Nux vomica. Means what? Now when Nux vomica was proved, okay, there was a prover who had a lot of symptoms. Okay, so these symptoms are what we study under Nux vomica, and we will study those group of symptoms as we go ahead in the video. So now E.B. Nash says that when that specific group of symptoms is present in your patient and he has had drugs, aromatic pills, but those drugs, aromatic pills has created these only group of symptoms which you have studied in the proving of Nux vomica, then Nux vomica will cure. It will cure only the cases in which it is homeopathic. Okay, that is what he means. So because no, in that time, at that time, many physicians were like giving Nux vomica on basis of this symptom. They were not looking at the understanding that you should have the group of symptoms which Nux vomica produces. Okay, although the ailments from is the same, the patient has taken hot medicines, the patient has taken a lot of ginger, a lot of paper, a lot of stimulating stuff, okay, a lot of drugs, bitters, herbs, okay, but still the symptoms should be of Nux vomica for you to prescribe Nux vomica and for the patient to get benefited from Nux vomica. Now let's go ahead. He further explains about the same concept. So now he says that another fact is that these drugs, aromatics, etc., do produce such a condition. What a condition? So they do produce a group of symptoms which is similar to Nux Vomica. So this is a fact that when a patient takes a lot of drugs, a lot of aromatics in excess, okay, then there is a production of such a condition which is similar to Nux. And that is why the physicians invariably prescribe Nux Vomica as a first remedy, okay, in cases coming from allopathic hands without even examining the case. So whenever a patient comes from from allopathic hands, he has been, moving from one doctor to another, to another, to another, and finally he comes to you because he has not actually, the doctors have not like the they have not been able to cure his disease, and he finally comes to you. You already know that now he has already taken a lot of allopathic medicines, right? Because he has been to so many doctors and he has been fed up of his disease in so long. So he has taken a lot of allopathic medicines, and then the physicians will first go ahead with Nux Vomica, first prescribe Nux Vomica without even examining the case, without even taking the case, thinking about it, because they know that a lot of allopathic medicines have been taken. But what does Dr. Nash says? But this is unscientific. This is unscientific. Okay. Now why? Because we have a law of cure. In homeopathy, we do have a law of cure which says that whatever symptoms are produced in the proving of Nux Vomica, when you are present, your patient presents with that exact group of symptoms and you're prescribing Nux Vomica, then Nux Vomica will cure those symptoms, okay, will treat those symptoms, will help the patient. But you are prescribing without even looking at the case. So that is unscientific. Unless Nux Vomica is homeopathically indicated to the case, it won't antidote the effect of drugs. It also won't cure the disease condition. It should be homeopathically indicated. Even if the cause remains the same, that they have taken drugs or aromatics or whatever be the cause, the symptoms should be the same, right? So this is the concept which he puts forward while explaining us the characteristic which has been given by Herring knew this concept, okay, but people who read it will like take it only without the concept and will prescribe invariably, but you should always look at the group of symptoms, okay. So next, Dr. Nash explains us the temperament of Nux Vomica. So he again mentions some symptoms from Herring's card symptoms. So he writes that temperaments that are most susceptible to the action of Nux are these. Now what he says, first of all, they are very oversensitive. Every harmless word offends them. Every little noise frightens them. They are anxious, and besides themselves, they cannot bear the least even suitable medicine. So that is what they're very, very sensitive. Every, even you do not even say any harmful word, okay, but that will offend them, and they will get frightened even if little noise comes and all that, okay. They are very anxious, and besides themselves means that they cannot even control their own feelings. When they are in that anxiety, they just become besides themselves. They just cannot understand what's going on. They become very anxious. They cannot bear the least even suitable medicine, okay. It is also for very particular, careful, zealous persons, okay. What is zealous? They're very enthusiastic, okay, very excited. These kind of people are called as zealous people. They are very careful, very particular about things, okay. This should be over here only and not like this and not like that. It should be like this only, okay. So they are very particular about and careful about everything. They get inclined to get excited or angry. They get angry, okay, or they are of a spiteful, malicious disposition. So what is the meaning of spiteful, malicious? Means that they have an intent to cause harm to others, to offend others. So that is what is there inside of them. They want to do that, okay. So that is spiteful, malicious. They have disposition to do that, okay. They are inclined to harm others or offend others. So this is a kind of temperament. So when you put it all together and imagine that kind of person, then you create a graphic picture of what is called as nervous temperament, okay. These kind of people come under nervous temperament. They are very oversensitive, whatever you do, they are very nervous. They get anxious or they get frightened by little noise also. If any harmless word also you say, then they'll get offended, and they'll be very angry. Even if you do some little mischief, they'll get very, very, very angry. They'll be getting excited, careful, zealous, particular person, okay. Then other remedies in which you can find this nervous temperament are chamomilla, ignitia, staphylococcus, and there are many more. But right now, Dr. Nash only tells us about few of them. He only he always likes to make out the similarities, point out to the similarities, or the remedy is just similar to the remedy we are discussing, etc. Now he says that there is also another kind of condition or subtype of nervous temperament of Nux vomica. So right now we saw one of the type of it, okay, one of the behavior or one of the disposition of Nux vomica. There is also another subtype of nervous temperament, right? So these both come under nervous temperament, but the first one was one of its kind. Now the second one is that these people are those who are not so excitable. Okay, right now we were discussing about those who are oversensitive, who are like get very anxious very soon, but now these people are not so excitable. They are hypochondriacs. They are studious men. Okay, they are studious men, they are hypochondriacs. They will sit too much at home, okay, and then that will give him them abdominal complaints and costiveness. But even in these kind of temperaments, okay, now how will you make out its Nux vomica? Because Nux vomica has its core, right? The core of Nux vomica will remain the same. Whatever is the essence of Nux vomica will always remain the same, even if those people are very, quiet, silent, and good bacha. But then also they will have certain kind of symptoms which are very, basic to Nux vomica. So those are irritation, anger. So very little irritation will make them angry or irritable, even in these kind of people. Okay, so that is how he gives us two graphic pictures of the nervous temperament. All right. And then he says that if the gloomy or hypochondriac condition of mind persists even after irritation. Okay. Now in Nux vomica, what we saw, that those are hypochondriac people. Okay. Those are studious men, those who sit all day long. Okay. But if you irritate them, they will get angry, right? But in the second thing, he compares other remedies and says that if this condition of mind still says the same, okay, even after irritating, then you have to think of other remedies. Then it is not Nux vomica. But what are the other remedies? You can think of aurum, natrum mur, okay, etc. But right now he only compares aurum and natrum mur. So if it remains, it's aurum or natrum mur. It can be. All right. So these were the first 2 points we discussed about the characteristic of herring, about the aromatic spills, etc. And now we discussed about the temperament of Nux vomica. Let's go to the action of Nux vomica, firstly on the digestive organs and secondly on the female reproductive organs. So he further explains about the action on digestive organs, first talking about constipation, because it is very characteristic in Nux vomica. So, in the constipation of Nux vomica, there is frequent and ineffectual desire to defecate or passing but small quantities of feces at each attempt. So, in these people, there is desire to defecate, but it is frequent. Okay, right now they have defecated, they have passed stool, but still after some time they will again want to pass. Okay, they will again want to have the urge, and there is ineffectual. So what is the meaning of ineffectual? We have already discussed the meaning of ineffectual in the remedy arnica, right? Because it had come in it in the labor section of arnica. But right now it means that ineffectual means whenever something is not able to produce the effect. Okay, so your desire to defecate should be able to make you actually have the urge to defecate, make you actually help pass stools, right? But here it is an ineffectual desire. This desire is of no use, no effect. So this patient has this frequent desire, but it is of no use because he is not able to pass stools, okay, satisfactory amount of stools. Or that is passing small quantities of feces. So not satisfactory amount, okay, small quantity. And again when he comes out of the toilet and he'll again want to go again and want to pass stools, but again it will be ineffectual and there will be very small small quantity of feces which will be passed, and this gives him this frequent and ineffectual desire, which is very 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 characteristic of Nux vomica. We should never forget this kind of symptom of constipation of Nux vomica. Okay, and he also, now Nash says that this is pure gold symptom. Okay, it is a guiding symptom in constipation. because as I told you, it is very, very, very important in Nux Vomica. Nash says there are few other remedies also that have this symptom, okay, but none so positively and so persistently. That is why it is very important for Nux Vomica. Many remedies have this kind of symptom: frequent desire, ineffectual desire, small quantity of feces, but the most characteristically it is present in Nux Vomica. Okay, then Carol Dunham wrote, while Nux vomica and bryonia are equally effective for constipation, yet they are very different. Now that is where the interesting part of materia medica comes. Okay, now both of them have constipation, but how are they different? So this is a differentiation table that Nash gives us. Okay, in Nux vomica, the constipation is caused by irregular peristaltic action. Okay, and bryonia, we've already seen, it is caused by lack of secretion in the intestines. So, what is irregular peristaltic action? Normally, you know that our whole alimentary canal has a peristaltic action like this, right? So, it pushes the stool forward, and when in esophagus, it pushes the bolus forward. Okay, so this goes on until the rectum, right? This peristaltic action, but in Nux vomica the peristaltic action is itself irregular. So how will the stool go ahead, or how will it go ahead? So that is why there is this constipation present in Nux vomica. Okay, the stools might be very, like, the secretion might be normal, the stools might not be very hard. Okay, but what happens is that the peristaltic action is not normal for the stools to go ahead. Okay, but in bryonia there is complete lack of secretion in the intestines, complete, or like there is diminished secretions. So that is why the stools itself are very hard, they're like burnt stools. So that they're so hard that even if the peristaltic action is good, they're not able to move forward, or they're not able to, like, they're very hard to it is very hard to pass stools. So that is why in bryonia there is constipation because of lack of secretion, but in Nux vomica there is irregular peristaltic action, remember. Okay, and desire for stool also differentiates, because in Nux vomica, as we've seen, there is frequent ineffectual desire, and bryonia there is absolutely no desire. All right. Okay, so next he goes on to tell us about some few points about dysentery. He says that this frequent ineffectual kind of desire is found also in dysentery. Normally dysentery means blood in stools. Normally whenever diarrhea or dysentery happens, there is a lot of frequency of stools, or there can be a lot of quantity of stools that goes, okay, that passes out. But now here there is frequent but ineffectual kind of desire. The stools are frequent but again small and unsatisfactory. Even in dysentery, the pain is relieved for a short time after every stool. So now you will say that, so what is different? Okay, after a stool, the pain will get relieved only for some time. If it's a good hoga and they'll have to go. But that is not the case. When you see in Merck, okay, when you compare it with Merck will have pain and tenesmus which continues after stool as well. Okay, so that is why here it is very important. The pain is relieved for a short time after every stool. Whereas in Merck, it will not be relieved. Even after the stool, it will continue. Okay. Then this was the constipation that we have discussed until now. And then we'll go to the gastric symptoms, right? In constipation, we learnt about the very, 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 very pure gold symptom, very important symptom of Nux vomica, frequent ineffectual desire to defecate. We differentiated between Nux vomica and bryonia, and we also talked about the dysentery. Now let's go to the gastric symptoms. So now he discusses about the gastric symptoms, in which he says that after eating, okay, first this line is these two words are very important, because Nux vomica has aggravation after eating. Okay, so after eating there is sour taste in the mouth. Okay, sour taste is there in the mouth, khatta wala taste. There is pressure in the stomach an hour or two afterwards. After eating, an hour or two after eating, there will be a kind of pressure that they will feel in their stomach. There will be hypochondriacal mood along with it, and confusion. He cannot use his mind. So that these both things will be there. Hypochondriacal mood will be there, confusion will be there after 1.5 hours of eating their food. Then there is tightness about the waist. They want to loosen their clothing, and this same symptom is also found in lycopodium, very characteristically calcarea lachesis. Alright. Bloating of epigastrium is seen. There is pressure as from a stone in stomach, and this you have seen in both the remedies, that is bryonia and pulsatilla as well. Right. Then Nux vomica has a wide range of action in gastric troubles, but one particular symptom, one peculiar symptom is peculiar aggravation of stomach symptoms an hour or two after eating. Now, immediately after eating, aggravation is seen in Kaliba and Nux vomica, Nux moschata, sorry. In Nux Vomica, the aggravation is an hour or two after eating, and in Kalibai and Nux Moschata, it is immediately after eating. Okay, so what did we see? After eating, there is sour taste in the mouth, pressure in the stomach, hypochondriacal mood, confusion. Okay, tightness about the waist, must loosen clothing. This is also very characteristically seen in lycopodium. Bloating of epigastrium is seen, pressure as of stone. Then we go ahead to talk about the causes of gastric complaints. Alright, so the cause of gastric complaints in Nux Vomica, as we've seen earlier while differentiating it with other remedies, while talking about Bryonia pulsatilla, that the cause is coffee, alcoholic drinks, debauchery, abuse of drugs, business anxiety, sedentary habits, as we've seen in the temperament, the patient, like they want to sit all day, they have very sedentary habits, want to study and sit. Okay, too high living, broken rest from night, long night watching, etc. Cocculus, cupromet, and nitric acid also present in this. So they are like, they have this alcohol, they'll be smoking, or they'll be having drinks. Okay, they'll be having a lot of drugs, abuse of drugs, they'll be doing abuse of drugs by having a lot of them. They'll have this business anxiety, they're anxious kind of people. We already saw they are anxious kind of people, and they are very zealous, also very enthusiastic, so they'll be very passionate about the business that they're doing, but along with it comes a lot of anxiety. They'll have this business anxiety, they'll have this sedentary habits. Okay, sedentary habits means when you have to sit all day and do something. Okay, that is sedentary means बैठना पड़ता है पूरा दिन पूरा time बहुत time वो. Okay, then too high living. So what is this? Having alcohol, having all types of like herbs and like a very stimulating food. All this is too high living only. So too high, मतलब one of the aspects of too high living, obviously not completely, but still too high living. And broken rest from long night watching. तो रात को बहुत टीवी देख लिया, कुछ भी रात को बहुत ज़्यादा किया, रात को जगे हुए रहे बहुत टाइम तक, तो रेस्ट नहीं हो पाया उसकी वजह से, and that is giving them a lot of problems. So that is a cause also. And very important is the very characteristic rectal symptoms are apt to be present in the case. So Dr. Nash, emphasizes on this point a lot. He says that in Nux Vomica, there have to be rectal symptoms, okay, along with gastric symptoms or along with female reproductive related symptoms. Okay, they have this rectal symptoms. So it is like normally present with all other complaints. So this was about the action on digestive organs. First we talked about the constipation of Nux Vomica, and now we talked about the gastric symptoms, in which there was tightness about the waist, especially aggravation was after an hour or two after eating. And we also saw the remedies which had aggravation immediately after eating. Those were Calibicromicum and Nux Moschata. Then we also saw the cause, which we have already also seen: alcoholic drinks, debauchery, abuse of drugs, business anxiety, etc., etc. And very characteristic rectal symptoms which are apt to be present in the case. Okay, now let's go on to the action on female reproductive system. So the first symptom he tells us in the action on female reproductive system is catamania, which is menses a few days before time and too copious. So they are too early. A few days before time means they come early on, and they are too copious, means a lot of flow is there. The quantity of blood that passes is a lot. Okay, so that is ketamine, that is seen in Nux Vomica. The menses come on too early and they're too copious, and this is often a verified symptom. That is what Dr. Nash says. Okay, this is often a very verified symptom. Complaints start from the onset of menses and continue until after it's over. So whatever complaints they have during the menses, okay, they will start with the menses, but even after menses are gone, the complaints will continue. Such menstrual complaints are often seen in young girls or women at climacteric. So these type of symptoms, okay, these type of complaints that they are coming too early, that they're too copious, etc., they're all seen in young girls, okay, who are just started to menstruate, for example, or who have been, who are young, and or women at climacteric, okay, who are near their menopause. At climacteric means who are around their menopausal period, okay. And other remedies for too early, too copious periods is one of them is Calcarea austrium. But how to differentiate? So its temperament is very different than Nux Vomica. You will be very easily able to differentiate because its temperament is very, very different. They are not of nervous temperament, okay. And often the characteristic rectal symptoms are also present. That is also seen in Lilium tick, and in Nux Vomica also they are present. What are these very characteristic rectum symptoms that we have been talking about? They are pressing down pains in abdomen which extend to the rectum, sometimes to the neck of the bladder as well. Okay, they extend from the abdomen to the rectum. All right. So these are the few symptoms that he talks about. Catamania is there, which is too early to copious, right? And we've seen also that the characteristic rectal symptoms come from the abdomen and go to the rectum, right? Extend to the rectum. Then in labor pain, again we're talking about labor pain. When was the last that we talked about labor pain? We talked about it in Arnica, right? When we were discussing about Arnica, if you remember. So in Arnica also there was ineffectual labor pains. Means what? That the pain was not enough to really cause the labor, to really cause parturition or delivery. Now these pain also extend to rectum, as we have seen that they are very characteristic rectal symptoms. So these pains also extend to rectum. There is desire for stool and frequent urination or micturition during the labor. Okay, quickly relieved. These pains are quickly relieved when you give a dose of Nux Vomica 200. Alright, the other symptoms should also be present. The temperament of Nux Vomica, or at that time the patient must be very nervous of showing you a nervous temperament, and the other symptoms of Nux Vomica, which we will study when we go also study about Nux Vomica from what other authors have to say about it. He further talks about the menorrhagia of Nux Vomica. Menorrhagia means it's a disorder related to menses. Okay, which means heavy or prolonged bleeding during menses. And along with that, Nux Vomica will also have gastric troubles present and morning aggravation. And if you have these two symptoms along with menorrhagia, you have to be sure that the remedy is Nux Vomica. Alright, then he also discusses about certain types of modalities of Nux Vomica. Okay, certain modalities of Nux Vomica in which we've already seen that they are very aggravated after eating. Okay, I've seen that they're very aggravated after eating. After eating, they will be like lutu putu, and they'll be aggravated. They'll have symptoms. Then we also see that they are aggravated from mental exertion. Okay, if they are doing any kind of mental exertion, that will give them some symptoms, that will give them mental confusion, whatever. Okay, but some symptoms, they will be aggravated by it. After eating, they will be aggravated. They will be aggravated in morning, soon after awakening. And this aggravation in the morning we have seen a lot when we were discussing about pulsatilla, because when we were talking about pulsatilla, Dr. Nash has also compared it with Nux Vomica, and when he writes about pulsatilla, he has given that Nux Vomica is very aggravated in morning, that we have already seen, and in cold air also is aggravated. So after eating, anacardium reverse. So what does this mean? That anacardium is better after eating, but Nux Vomica is aggravated after eating. So this is reverse. And Nux Vomica is aggravated in cold air, but pulsatilla is reverse. They feel better by cold air, right? We've seen they feel better by cold, cool, open air, right? Then in fever, we see the characteristic symptoms. Now this is the fifth point. In fever, we see that there is great heat and the whole body is burning hot, especially the face is red and hot. And also the body is burning hot, but the face is very red also. And yet the patient cannot move or uncover in the least without feeling chilly. So now this patient is not able to move or uncover. Like when he has heat and when he is a patient of fever, he is covering and sleeping. Okay, he has a blanket all over himself and he's sleeping, but now his whole body is very hot, very red, right? His whole face is red, his body is hot. And because of that, normally what a person would like to do, he would like to uncover, like because he's already feeling a lot hot. But now when Nux Vomica will uncover even the least, he will start feeling chilly, so he has to cover again. When he covers again, he feels hot. When he uncovers a little bit, he feels chilly. So this story goes on, and that is a very very characteristic symptom of Nux Vomica. And we've also seen this in Arnica. So it is also present in Arnica and Nux Vomica as well. Okay, so this kind of story. Okay. Then we talk about the next point, which is headache of Nux Vomica. So in Nux Vomica, the headache will often occur in conjunction with gastric, abdominal, hepatic, and hemorrhoidal affections. Okay, maybe you have headache and you also have hemorrhoids. The patient has headache and he has some liver complaints, some abdominal complaints, some gastric complaints. So most of the times the headache is not present on its own without any other symptoms. So most of the times these symptoms are present, and along with that the patient has headache. So what are the modalities his headache gets aggravated from? Or in general also you can think that these modalities aggravate him. So there is aggravation from mental exertion. We've already seen there is aggravation from mental exertion. There is aggravation in open air. As we've seen, it is opposite to pulsatilla. Okay. Then there is aggravation from chagrin or anger. So what does chagrin mean? Chagrin means the annoyance, okay? When you feel annoyed because you have been humiliated, okay? When you feel distressed because you have been humiliated, it is actually चिढ़ना. तो चिढ़ जो आ जाती है हमको, that is chagrin. और anger means again वही गुस्सा, राग, okay? That is anger. In open air also there's aggravation, which is opposite to pulsatilla. On awaking in the morning, that we've already seen. After eating, we've already seen. From abuse of coffee, spirits, we've already seen that there's all these stimulating things like alcohol, smoking, coffee, tea, herbs, like hot medicines, all of them aggravate them. Okay. Sour stomach in sunshine, so sun also aggravates the headache, especially whenever they go out in the sun, they'll have headache from light, from noise. Okay. On stooping, when moving or opening the eyes, like in bryonia, so we've seen this also in bryonia, right? Bryonia may there is least motion will aggravate them. Okay, so even the movement of eyes aggravates their headache. How interesting this symptom is. Like they have motion aggravation. Okay, we are like, when we study about it, we're like, okay, they have motion aggravation, but when we really understand, even the slight motion of their eyes is giving aggravation, okay, is increasing their headache. That means, like, how interesting is that to have it? Okay, so that is also seen in Nux Vomica. Their headache also gets aggravated when moving or opening the eyes. Okay, from coughing, from high living, highly seasoned food means एकदम तड़का वड़का मार के खाना बनाया है, बहुत ज़्यादा तीखा, highly seasoned food. In stormy weather, okay, after drugging, that also we have seen as the first point which we discussed in Nux Vomica. From masturbation if they have headache, from constipation or hemorrhoids if they have headache, then also this remedy can be thought of. Now these headaches of Nux Vomica may or may not localize in any particular part of the head. So normally when we are studying about headache, okay, or whenever we have a patient of headache come to us, there are certain kind of questions that we have to ask to that patient. Okay, so when we are asking about headache, the important question is the locality or the location of the headache. Okay, so in certain patients, okay, whenever patient come to you, they'll tell you my forehead pains, and the forehead pains especially when the patient has sinusitis, right? Because sinuses are present, right? So forehead, the pain may be localized to forehead. Some patients will tell you that their occiput is painful. Some will tell you that the temples are painful. While some will tell you that the vertex is painful. So remember, whenever you are studying headache of any remedy, you have to understand which locality, okay, pains in that remedy, which location pains in that remedy. And even if the patient comes to you, you have to ask this question, because it will eventually help you in choosing the remedy for that patient. Now when you talk to the Nux Vomica patient, he will tell you that his headache may or may not localize in any particular part of the head. They will usually say that it feels badly and aches all over. So this is what Nux Vomica says. Nux Vomica patient आएगा, आप उसको पूछोगे, what will he say? He will say कि no, there's no such specific location where it is painful, okay? Or the whole head is paining, or the whole head is aching. Okay, so this was about the headache of Nux Vomica, and we saw a whole list of modalities while talking about it, which not only aggravate the headache of Nux Vomica actually, but in general also it aggravates. Let's go to the backache of Nux Vomica, which is the last point Dr. Nash explains. So when he talks about the backache, he says that the patient is apt to have backache in bed. Okay, matlab when he's lying down, he must sit up to turn over. So the backache in bed is so much that he cannot even turn over while lying down. He has to sit up, then turn over, and then sleep again. Okay, so that is what he has to do whenever he wants to turn. That much is the backache in bed. Aggravated when standing, like in sulfur, and aggravated when sitting, like in cobalt, pulsatilla, rustox, zinc. But the most characteristic is aggravation in bed. Alright, then mostly the backache is in lumbar region. So now when we were studying headache, I told you that some specific location is present in some kind of, in all remedies, like they have their own location. Okay, so in backache of Nux Vomica, the location is lumbar region. Okay, so the lumbar region aches. The backache is often present in conjunction with hemorrhoids. So he with him rectal symptoms are present, right? We've seen until now the rectal symptoms will be present even with gastric symptoms, even with female reproductive system wale symptoms, and even with backache right now. So it is present with hemorrhoids, and this same thing is also there in aesculus hypocastinum. So in aesculus also backache is also associated with hemorrhoids. It is very 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 characteristic of aesculus. You should remember this right now only, that in aesculus the backache is also associated with hemorrhoids, and there is aggravation in aesculus from walking and from stooping. Now, when we talk about the cause of the backache in Nux vomica, one of the causes is masturbation as well. We've also seen in headache that it is aggravated by masturbation. So in general, also it is aggravated by masturbation, and in backache also there is aggravation by or caused by masturbation. And this is one of the best remedies. Okay, one of the best remedy for this thing is Nux vomica. Alright, okay. Then Nux vomica has action upon the spinal cord, including the motor and sensory centers as well. Okay. Dr. Nash says this here because he tells us that it does have an action upon spinal cord, motor sensory centers, but right now I'm not discussing anything about it because he says that my like he now keeps ahead his aim of writing this book, okay, which is very important for us because we're studying this book. So what does he say? He says that our aim in this work is not to write exhaustively upon any remedy, okay? Not to write a lot about any remedy, write exhaustively upon any remedy, but to point out a few chief virtues and characteristic symptoms around which all the rest resolve. Okay, so in this remedy, our work, he says, is not to write exhaustively about any remedy. Okay, so he says that let us say here, it is not our aim in this work, but he because you also see that the name of his book is Leaders in Homeopathic Therapeutics. So he just gives us the leaders, the pointers, the chief symptoms which will help us in prescription. Okay, it is not to study the Materia Medica exhaustively. Okay. So this was all about Nux vomica. When he actually Dr. Nash starts writing about any remedy, he first gives a few pointers and then writes it like a lecture. Okay, so those in the first few points that he gives in Nux vomica, there are certain points which we haven't discussed. Okay, because they have not been very well explained; they have just been mentioned. But now I want you to go through it. Okay, I want you to open the book and read those first few points that he has mentioned, and those also consist of a point of some points that we have discussed already, but a few, only 2 or 3 points are there which we haven't discussed. So please go through it, and that will also help you learn about it. Okay, I hope you all do revise, do read from the book, the actual book also, after going through the videos, and I hope it's helping you. It's helping me also. Bye bye.